before your surgery, there's a lot of things that you need to pay attention to. There's a lot of details that we go over. And to make things simple, I've kind of put together a quick video of the 10 commandments of preoperative care. So there are really 10 things that you need to focus on when we're talking about preparing for surgery. The first thing is have a responsible driver and a caretaker that are arranged for your day of surgery. You're not able to take an Uber home from the operating room. It's just not safe. And you really, after having general anesthesia of any kind, should have somebody sitting with you, if for no other reason than to help for the first day after surgery. Rule number 2 is read the manual. We give you an extensive list of preoperative instructions that really go through soup to nuts everything you need to know about the surgical process, both before and after. There's a lot of information in there, so be sure to read it carefully because it answers a lot of questions. But if you have any questions, call the office. We're happy to help. Rule number 3 is pick up your medicines right after your preoperative visit. This is really important because a lot of the pharmacies will reshelve or restock medicines after a few days, and you'll show up to pick your medicines up the day or 2 days before surgery and it won't be there. And you'll panic, you'll have to call the office, we'll have to recall it in. It just makes it everybody's life easier if you pick up those medicines the day or 2 after your preoperative visit. Rule number 4 is drink enough fluid the day before surgery. Really focus on going into surgery well hydrated. And that means for most adults, 2.5 liters of water the day before your surgery. Not only does this help you from being thirsty after not having anything to eat or drink after midnight the night before, but being hydrated also helps minimize postoperative nausea and vomiting. Rule number 5, shower before your surgery. Make sure you wake up in the morning, take a shower, use antibacterial soap, and get yourself clean. That's just a good hygiene and can help prevent postoperative infections by being clean the day of your surgery. Along with that is Rule 6, clean out your belly button before surgery. Especially for body contouring cases like belly button lint and like the gross stuff that collects in your belly button. One of our nurses really gets grossed out by some of that stuff. So I'm actually putting that in there as much for her as for you. Rule number 7 is make sure you take your preoperative antibiotics an hour before surgery. And for most patients, that means either when you're leaving home or shortly before you leave the hotel if you're here from out of town. We use oral antibiotics before surgery as opposed to IV antibiotics. They work just as well in preventing infection. So take your antibiotics about an hour before surgery with a little sip of water. Rule number 8, if you've got piercings, remove them. And that means all of them, even if they're in places that are sensitive. Rule number 9 is wear loose clothing to the surgery center. So nothing tight. The cute Lululemon stretchy pants you think really look good, don't wear those to surgery. Wear something nice and loose. Wear a loose shirt or sweatshirt that either buttons up or zips up the front, and no go-go boots or high heels or anything else like that to the surgery center. You are asleep and kind of drunk as you're leaving, and those things are hard to walk in sober. So flat-footed shoes, flip-flops, sandals, things like that are easy to slide into are really preferable to anything that's lace-ups or heels. And lastly, and this is really a kind of a common sense thing, is don't get your eyelashes done shortly before surgery. When you're asleep, our anesthesia team puts a little piece of tape on your upper eyelids so that your eyes don't get scratched, something called a corneal abrasion. And getting new eyelashes shortly before surgery is just asking for some of those to get pulled off with tape. Okay, so those are the 10 commandments of preoperative surgery. And stay tuned for the next video where we go through the 10 commandments of postoperative care. So if there are any specific topics that you would like to see discussed or like to see a video or podcast made, please leave a comment below. Or if you're listening to the podcast, shoot me an email at info@drjasonhall.com.